To everyone and welcome to today's wonderful session. Today it is supposed to be a teacher-to-teacher interactive session with, we have three kinds: teacher-to-teacher, teacher-to-topper, and teacher-to NEET PG aspirants. Three different formats of combined study. But today, the doctor in psychiatry, who is the topper in NEET PG last year, she could not make it up because she has to catch up with the duty. So that is the reason I thought, let us have a discussion. Anyway, we are all prepared for the class. So this will be a rapid fire in psychiatry, and we will take around 40 common questions in psychiatry for the tomorrow's NEET PG exam, both from clinical case, clinical vignette perspective, and also single liners. Akarsh Shetty, Jitendra Verma, and many more who are all online, please inform your classmates that daily live class with Dr. Murali Bharadwaz has started, and please share it with all your classmates. So, doctor, yes, let's make the great beginning. A 48-year-old woman from Jaipur. Psychiatry is one subject that most medical students, we don't have experience. Everything is imagination when it comes to psychiatry. At most, the only psychiatric patient that we know is our roommate, right? So with that background, let us look into what are the common questions in the NEET PG when it comes to psychiatry and how you need to get better. A 48-year-old woman from Jaipur complains of long history of schizophrenia and loss of night vision. So which of the antipsychotic medications have the adverse effect of causing loss of night vision? Keep punching your answers, doctor. Akarsh Shetty, Jitendra Verma, and many more who are all online. You know, all these classes are supposed to be more interactive in nature. You need some amount of ventilation to come out, to discover a classmate, roommate, benchmate, tablemate. That is what Dr. Murali Bharadwaz to all of you every day. So make these sessions more interactive by punching your answers, whatever that you know, just like a consultant in the live broadcast. Please do that. But otherwise, generally we conduct these sessions with either one topper or a medical teacher. Generally, these sessions are a jugal bandi, but today our psychiatry teacher could not join. So that is the reason I am conducting it all alone. So, doctor, thioridazone can lead to a irreversible pigmentation of the retina, leading to the symptoms of night vision difficulty and ultimately to blindness is what you need to remember. Good to see Rishabh Shetty, Akarsh Shetty, very good. A 25-year-old man with bipolar disorder took too many pills. He had 2 seizures and now in coma. So what is that drug? Which is used in bipolar disorder, if taken in overdose, can lead to the development of seizures and coma is the question. Who is going to give me the answer? Rishabh, Akash, Jitendra. Who is going to give me the correct answer? Punch your answer, doctor. So you should remember lithium toxicity. To treat the lithium, we give dialysis whenever it is severe and life-threatening, typically leading to seizures and coma. Everything, anything about lithium you should know, doctor. Generally, NEET PG exam में 5 to 6 क्वेश्चन आएगा साइकियाट्री से, उसमें से कंपल्सरी एक क्वेश्चन आएगा लिथियम के ऊपर. That is what you need to be doubly sure about. Very good to see 12 online classmates. Now, a 38-year-old schizophrenic woman, she feels restless, cannot sit in a place still. So which drug which is used in schizophrenic women, can lead to akathisia, which is restlessness. You have to be very sure about. So, akathisia treatment is propranolol, basically. So, treatment is propranolol. 32-year-old woman with panic disorder and anxiety took an overdose of diazepam. She came with somnolence, hypoventilation. So generally, benzodiazepine overdose, how do you treat, doctor? Flumazenil is what you need to remember. But flumazenil has got a very short half-life. At least one case of benzodiazepine intoxication, if you see, you will never forget. Flumazenil has a very short T-half. That is the reason what you need to do. After the first dose, patient will wake up. Once more, they will fall back. Because the original benzodiazepine will have a longer half-life. That is what you need to remember. So, Prashant Suryavamshi is asking, sir, how sir, propranolol? Very good. Good point. So, basically, all this restlessness has some component of sympathetic overactivity, doctor. That is the reason propranolol is the one which is used to treat the akathisia. Dr. Prashant Suryavamshi. Now, doctor, a 30-year-old man is being treated for schizophrenia, complaints of tremor, slow gait. Now the question is, what is the drug that can be responsible? All these Parkinsonian-like symptoms, wherever you are giving neuroleptic agents are used, kahan use karte? Psychotic, antipsychotics are all neuroleptic agents. Whenever Parkinson-like symptoms develop, whenever you are using the dopamine antagonists, which are all these neuroleptic agents, that should be treated by giving amantadine or levodopa, is what you need to emphatically remember. Very happy to see 16 online classmates. आप रोज आइए, रोज हम मिलेंगे, बैठेंगे, पढ़ाई करेंगे 1-2 घंटे, ताकि आपको वो required energy होना चाहिए. So a lot of students, they came and requested, sir, एक तरफ से कोविड है, एक तरफ से एंट्रेंस कब है मालूम नहीं, एक तरफ से प्रेशर है, घर में प्रेशर है, हॉस्पिटल में प्रेशर है, ड्यूटीज का प्रेशर है. इस चक्कर में हम इतना टेंशन में रहे तो ये पूरा कोचिंग सेंटर वाले फोन करके तेरा सब्सक्रिप्शन खत्म हो गया, एक्सटेंशन के लिए पैसा पे करो बोल रहे. So then we decided one day, 999 rupees spent for 3 years can be given activation. 1000 rupees में 1000 rupees में 1000 days का कोचिंग दे सकते हैं या नहीं? क्यों नहीं दे सकते? Definitely दे सकते. There are 800 hours of video content, almost all 600 hours of daily live online interactive class, 60 full-scale grant tests with discussion, 60,000 multiple choice question bank in the form of quiz tournaments, thousands of 3-minute learning videos in the TikTok style, and also you get analytics on how is your performance. All this just for 1 rupee a day. So don't forget to call our helpline. If you have not yet joined, subscribed, there is no need of wasting money on 70,000, 60,000, plan A, plan B, or some bakwas hai. The only person in this world who every minute thinks for you and want to see that you become a topper in the NEET PG is Dr. Murali Bharadwaz in this world. Please remember that. So just by paying 999 rupees only, you get 1000 days NEET PG coaching with everything. So please feel free to call 9000-868-356, which is our helpline number. 9000-868-356 is our helpline number. खाली हम वीडियो नहीं देते, रोज आपके साथ बैठेंगे, आपका हाथ पकड़ेंगे और पढ़ाएंगे, हम भी पढ़ेंगे. So that is our vada to all of you. Now, doctor, a 14-year-old adolescent boy being treated for attention deficit hyperactivity disorder complains of not being able to go to sleep in the night. So typically, one of the drugs which is used to treat the ADHD is methylphenidate. Methylphenidate का side effect होता है insomnia. That is the reason generally we prescribe the patients to take it in the late afternoon or early evening. Very important, not in the late night. Very important thing about the methylphenidate. A 56-year-old man on the night shift, just like medical students, house surgeons, interns, residents, night shift is part of many other professions also. He complains of excessive daytime sleepiness. How do you want to treat? Modafinil is the drug that you need to remember. Modafinil is used to treat the excessive daytime sleepiness in shift workers. A 39-year-old man tries to commit suicide by taking an overdose of amitriptyline and he died. So why amitriptyline overdose lead to it? Amitriptyline क्या होता है? पहला tricyclic antidepressant. Tricyclic antidepressants typically have anticholinergic effect. Anticholinergic effect. And also they lead to a long QT. Long QT. भैया normal QT कितना होता है? How much will be the normal QT? So you should know always QT divided by square root of RR interval. That's called corrected QT. Normally this corrected QT value is 400 milliseconds. If it is more than 600 milliseconds, then you call long QT. And that lead to, what does it lead to? Polymorphic ventricular tachycardia, polymorphic VT. And that will kill the people. So that is the reason, that is the cause of the death in somebody who has taken tricyclic antidepressant overdosage is what you need to remember. 35-year-old woman with bipolar disorder delivers a newborn with spina bifida. So what is the drug of bipolar disorder that can lead to spina bifida? Typically, in those who are having bipolar disorder, we use valproate as a mood stabilizer. And the valproate has the risk of leading to the neural tube defect is what you need to emphatically remember. A 38-year-old woman is admitted for elective hysterectomy. On the day 3, on the hospital, she develops auditory, visual hallucinations, tremors. She is agitated. What could be the reason for that? Always remember, people who regularly take benzodiazepine, like रोज एंजाइटी के लिए एक alprazolam ले लो बोल के रोज बेंजोडाइजेपिन लेने वाले बहुत लोग रहते हैं. Similarly, daily alcohol consumers, they typically develop withdrawal symptoms, delirium tremens. Whether it is delirium tremens or benzodiazepine withdrawal, treatment is to give benzodiazepine only. So that is the reason you need to treat her by administering benzodiazepine is what you need to remember. Very good to see Nihar Chandra and Maria Khan. 1 minute, I'll just get some water. So you should basically know that benzodiazepines can lead to the development of the withdrawal. Whenever you stop the benzodiazepines is what I want to underscore to all of you. A 32-year-old man who hears voices, at times complains of fever and chills. His temperature is 102, no infection, WBC count elevated. So what medication is mostly responsible? So भैया इसको बोलते हैं typically the hearing voices, fever, chills, high temperature, high WBC count. Actually, it is a neuroleptic malignant syndrome leading to hyperthermia is what you need to remember. A 32-year-old woman has been taking medication for her psychiatric problem. She complains of excessive thirst and she is urinating all the time of the day. What is the most likely diagnosis? So you should remember all these symptoms: excessive thirst, urinating all the time, they're all suggestive of diabetes insipidus. In psychiatry, it is the lithium used in the bipolar disorders which can lead to the development of the diabetes insipidus is what you need to remember. So, psychiatry में 6 questions आते, उतना tension कुछ भी नहीं है psychiatry में because maximum there are about 1000 points. If you master this 1000 important key points, then you can easily answer. एक मर्तबा आप रिविजन करें तो भी हो जाएगा, right? So if you go back to the Incus app, you have everything, anything that you need in psychiatry. The videos, PowerPoints, notes, everything is available. Just you can go and do the revision. So 19-year-old adolescent suffers from bulimia nervosa and very depressed. She is also suffering from insomnia, apathy. So which medication you should avoid is a very important question. So there are 2 important contraindications for bupropion. Please remember. One is seizure disorders, other is eating disorders. Because bupropion is known to lower the seizure threshold and bupropion lead to anorexia. That is the reason for bupropion, 2 important contraindication, liklo, seizure disorder, second is eating disorder is what you need to remember. A 24-year-old with a history of depression is being treated with sertraline. He enjoys drinking beer on the weekends. So what is the most likely side effect which can occur by using sertraline is very important question. So sertraline क्या होता है? Fluoxetine, sertraline, they are all SSRIs. SSRIs typically lead to the development of sexual dysfunction is what you need to remember as the important side effect. A lot of students struggle with psychiatric pharmacology. But NEET PG के 200 वाले questions में at least 3 to 4 psychiatry, antipsychotic medications, antidepressants, blah, blah, blah. Anything can come. So be very sure about it, doctor. Now, because of this side effect of sexual dysfunction, the patient is switched to another drug. He comes to emergency several days later with muscle spasms, confusion, fever, tachycardia, hypertension. What is the most likely possibility? What might have happened? So this patient who was on SSRI, that is the sertraline, because of its sexual dysfunction, डॉक्टर साहब बात उस दिनों का नहीं हो रहा है, is what the patient will be hinting you. So this patient on SSRI sertraline is moved to MAO inhibitor like phenelazine, and both the agents increase serotonin levels. इसलिए 5 weeks of time should be there between stopping the sertraline and starting the MAO inhibitors if you want to avoid the serotonin syndrome. Serotonin syndrome also, just like neuroleptic malignant syndrome, presenting features will be muscle spasms, confusion, fever, tachycardia, hypertension, etc., is what you need to remember. Is the broadcast loud and clear, doctor? Is the broadcast clear? Yes. I think sometimes small घर का वाईफाई से चल रहा है इंटरनेट, थोड़ा little disturbance sometimes will come, so just bear with me. Good, going well, very good, Rusha, thank you. So remember, doctor, every day evening, teacher versus NEET PG topper, or teacher versus another teacher, Dr. Murali Bharadwaz versus another teacher. कोई teacher ऐसे आके blah 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 teaching करते गए तो आप बोर हो जाएगा. But if you make it a conversation, always it is very interesting. Sometimes teacher versus 4 to 5 NEET PG aspirants. NEET PG aspirants. बैठेगा और खेलेगा MCQs के साथ. But every day evening you have one or the other session doing a revision of 50 MCQs. Please tell all your friends. Dr. Murali Bharadwaz is absolutely free on YouTube. Otherwise also Incus app download करो. Just 999 rupees pay करो, subscription ले लो और आपको 800 hours of video content, 60,000 MCQs, question bank, plus this 500 hours of live class, plus 35,000 PowerPoint slides of notes, and so many fringe benefits. Sab khali 999 rupees for 3-year subscription. Nobody can offer this cheap, right? But it is cheap but valuable. That's what you need to remember. So, doctor, 34-year-old man is seen in the emergency with headache, with giddiness, with BP 210 by 150. He feels fine, says that last night he even had a nice meal with wine. Then wine plus would psychiatric medication lead to sudden rise of the blood pressure? This patient had a hypertensive crisis between the wine and the phenelazine. Phenelazine, which is a MAO inhibitor. This is also called cheese reaction, is what you need to remember. A 57-year-old complaining, feeling giddy on getting up in the morning and when standing. She takes imipramine. Then what is the most likely cause of her symptoms is a very important question. So typically, imipramine, desipramine, ये सब tricyclic antidepressants हैं. They lead to alpha adrenergic blockade, is what you need to remember. So, doctor, there is alpha-1, alpha-2 receptors. Alpha-1 receptors act on the vessels, leading to vasoconstriction. But that is being broken by this tricyclic antidepressant that lead to the development of orthostatic hypotension, is what you need to basically remember. So good to see Pusa, Aravind, Rishabh, Shetty, and many more who are all online. Thanks for joining and coming to this session. So please share about the Incus Act 999 rupees package to all your classmates and tell them by 1000 rupees पे करे तो 3 साल तक free NEET PG coaching मिल जाएगा. जो 60,000 50,000 में costly देता है सब लोग, यहाँ तो 999 rupees पे मिल जाएगा. Right? Every day, lots and hundreds of students join on the Incus app because 999 rupees is the lowest, cheapest price, but at the same time valuable, more valuable than what is otherwise very costly. So basically, you should know one thing, doctor. What is the purpose of coaching? कोचिंग का पर्पस क्या होता है? ज्ञान पाने के लिए नहीं. It is not for acquiring knowledge. Please remember, no coaching guru can make you knowledgeable. Knowledge will only come, wisdom will only blossom when you are treating patients. Then why do you need coaching? You need coaching to get the drive, inspiration to start preparation, to prepare every day, to not leave the dream of becoming a topper. That is the purpose of coaching. 50,000 rupees, 70,000 rupees, crash course, O course, A course, plan A, plan B. All these things bakwas hai. 999 rupees of Incus. For 3 years, only 1 rupee per day. That is the only reality. क्योंकि यहाँ आपको मिलेगा खाली वीडियोस नहीं, वीडियोस भी मिलेगा, खाली वीडियोस नहीं, वीडियोस के साथ आपको यहाँ नीट पीजी टॉपर्स मिलेगा, रोज क्वेश्चंस डिस्कस करने के लिए. डॉक्टर मुरली भरद्वाज मिलेगा रोज आपको इंस्पायर करने के लिए, और मेनी अदर नीट पीजी एस्पिरेंट्स मिलेगा जिसके साथ आप लड़ाई करने के लिए. हम 60 फुल स्केल ग्रैंड टेस्ट एवरी संडे, a grand test with discussion. So don't miss that. So please make all your friends also to enjoy this democratic way of learning and imparting the coaching program for just rupees 999. So doctor, a 32-year-old with a history of psychiatric admission, 6 months previously is seen with painful erection. Oh, it's called priapism. This erection is there for the past 18 hours. What is the next best step, and probably which psychiatric medication lead to that? Trazodone के वजह से हो जाता है tragedy. What is a tragedy? Priapism. So you treat it by giving epinephrine injected into the corpus of the penis. Is the way to treat that. Priapism induced by the trazodone is what you need to basically remember. In general, the side effects of which drugs are anticholinergic, that is sedation, orthostatic hypotension, cardiac rhythm disturbances, weight gain, etc. Tricyclics and heterocyclic antidepressants का side effect होता है anticholinergic effects is what you need to remember. Generally, tricyclic antidepressants do not cause extrapyramidal symptoms. भैया इसका exception क्या होता है? Is there any exception to this rule? Yes, sir. Typically, amoxapine, which is a metabolite of an antipsychotic called loxapine. Though it is a tricyclic antidepressant, still it can lead to extrapyramidal symptoms, is what you need to remember. Selective serotonin reuptake inhibitors are commonly prescribed for depression, but they should not be used along with MAO inhibitors. अगर आप SSRIs को बंद करके MAO inhibitor शुरू करें तो कितना डिफरेंस रहेगा? It should be 5 weeks is what you need to remember. At least 5 weeks. to avoid the serotonin syndrome is what you need to remember. So what are the various symptoms of the serotonin syndrome? In that also, what is the first symptom to appear, last symptom to appear? Oh, you need to be very sure. Diarrhea, loose emotions, first symptom. Then restlessness, extreme agitation, hyperreflexia, autonomic instability, myoclonus, seizures, hyperthermia, rigidity, delirium, coma, death. So, diarrhea is the first symptom of serotonin syndrome to appear, is what you need to remember. So, what is the most common side effect of SSRIs? Most common. This is one of the very, very important MCQ in the NEET PG exam. NEET PG MCQ. लिख लो बेटा, लिख लो आपके 200 pages notebook में. Everyone should have their own 200 pages notebook, doctor, to become a topper. The most common side effect of SSRIs are GI disturbances and sexual dysfunction, is what you need to remember. What is that drug which is used for smoking cessation? But it should be avoided in the people with eating disorder in seizures. Sabhi abhi humne baat kiya. Bupropion. It has got an anorectic effect. That's the reason it should not be used in eating disorder and seizures. Which drug has all these side effects? Tremor, polyuria, diabetes insipidus, acne, hypothyroidism, cardiac dysarrhythmias, weight gain, edema, leukocytosis, WBC count badega. WBC count will increase. What is the drug? You need to remember lithium is what you need to remember. So this way of learning is called as flashcard method. Incus app may, on the Incus app, we are going to shortly provide flashcards. Ting, what is the question? Ting, what is the answer? Ting, what is the question? Ting, what is the answer? And you can bookmark it, last moment revision bhi kar sakte. You are going to get all these questions. The things that you should not forget, you need to keep in your heart, by heart, in the form of flashcards. So learning is very easy with Incus app. Everything for 999 rupees only for 3 years. Only 1 rupee per day is all that you need to spend when you are studying along with Dr. Murali Bharadwaz. Lithium is cleared from where? It is cleared through kidneys. That's the reason those who have renal failure or those who are aged people whose kidneys have slowed down, you have to be double careful to give the lithium. Which drug can be teratogenic and should not be given to the woman of childbearing age as a mood stabilizer? You should know. Valproate should not be. Neuroleptic malignant syndrome can be caused at any time with an antipsychotic agent. It involves movement disorders, autonomic symptoms. And what are those neurotransmitters whose levels become very high, leading to the neuroleptic malignant syndrome? And what are those laboratory parameters which become typically high? WBC count badega, creatinine phosphokinase badega, whenever there is a neuroleptic malignant syndrome, is what you need to remember. Now, the most common cause of intellectual disability. हम जीनियस होने के लिए भी रीजन नहीं रहता, क्योंकि जीनियस का बाप जीनियस नहीं होता. जीनियस का दादाजी इडियट भी हो सकता. सिमिलरली, एक जीनियस का बेटा मेंटली रिटार्डेड हो सकता. Genius ka grandson, he may not be able to even know how to write A or B or C or D. इसलिए idiopathic. Doctor is idiopathic, patient is in pathetic condition. That is called idiopathic. Idiopathic is the most common cause. Another important secret you should not forget. NEET PG entrance में जब भी idiopathic answers में रहे तो वही answer होगा. Please remember, nothing can beat idiopathic. What is the most common cause of hypertension? Idiopathic. Essential hypertension means किसी को मालूम नहीं था वो क्यों आ गया. रेगुलरली वॉकिंग कर रहा हूँ डॉक्टर, रेगुलरली मैं कुछ भी नहीं खाता हूँ डॉक्टर, साल्ट भी नहीं खाता हूँ, साल्ट भी नहीं पीता हूँ, फिर भी ये भी पिया गया, क्यों आ गया? इडियोपैथिक. Essential hypertension. A 2.5-year-old child is brought to the pediatrician. His history reveals various behavioral issues like poor interaction with peers and family, delayed language development, repetitive movements, difficulty accepting change. The child stiffens physically when touched. He does not respond to examiner, does not make an eye contact. So what is your diagnosis? What is your prognosis? One of the favorite questions of the examiner. Autism spectrum disorder. So earlier old terminology में Asperger syndrome, Rett syndrome, वो सब निकाल के एक ही लगा दिया. Asperger, autism spectrum disorder. So in these people, the language development is the most important indicator of the future developmental potential in the ASD children, is what you need to remember. And typically they will have difficulty with social reciprocity with autism, poor peer interaction, poor language development, repetitive and odd play. They are the important things. And typically autism disorder is more common. Boys are more often affected than the girls. Typically it is noticed by the parents before age 3 years. This is another favorite MCQ. Sometimes autistic children can be exceptionally great in mathematical calculations, etc., etc. No one can even imagine, and they can come out with such child prodigies. So what is the diagnostic criteria for autism spectrum disorder? Marked impairment of the non-verbal behavior, a failure to develop peer-to-peer relation, a lack of social reciprocity, stereotyped pattern of behavior. So these are the important part of the criteria which you need to basically remember. Which medication? There is a mild benefit for the irritability symptoms of the autism spectrum disorder. Aripiprazole typically is useful for irritability symptoms, temper tantrums, self-injurious behavior in the autistic children. Which is the best predictor? A autistic बच्चा future में normal बन सकता है या नहीं? What is the best predictor? Language development is a best predictor of the future outcome in autistic children. Do we have mental retardation often associated with autism? Mental retardation often, but not always. But not always. Every autistic child mental retarded banega nahi. That's what you need to appreciate. Lot of research went into allegation that agar vaccination diye to autism hota bachchon mein. Oh my God, that's very dangerous, such kind of claims. So later all studies have proven that the vaccination are not the cause of the autism spectrum disorder. So all this will come like a single liner in the tomorrow's NEET PG exam, doctor. A 7-year-old girl was referred by her teacher because inattention, idhar dekhta, udhar dekhta, upar dekhta, niche dekhta, distractibility, poor concentration, poor academic performance, problem in her grades. There is a difficulty to follow directions, disorganization, forgetfulness, but no depression, no psychosis, no developmental problems. So the most likely diagnosis is attention deficit hyperactivity disorder, predominantly of inattentive presentation. So how do you treat this condition? You should remember, we give a psychostimulant or atomoxetine, please don't forget, along with behavioral parenting training. That is what we recommend the treatment. So, Bhaiya, this is the most important table on which definitely एक MCQ निकलेगा कल के psychiatry में. What are the inattention symptoms, hyperactivity symptoms, impulsivity symptoms? Inattention, hyperactivity, and impulsivity. That defines the attention deficit hyperactivity disorder is what you need to remember. Atomoxetine is a new drug which is used for treatment of ADHD. There is also another drug called Ritalin. Ritalin versus atomoxetine, which is better, and why atomoxetine is better? Atomoxetine has a lower potential for abuse compared to Ritalin. Initial use can produce a feeling of sleepiness, grogginess, and the drug does not appear to exhibit its effects up to 3 weeks. And advantages of the atomoxetine is 24 hours control of ADHD. It has a longer half-life than the Ritalin is what you need to remember. A 7-year-old presents to a pediatrician with an uncontrollable blinking, which has worsened over the past several weeks. The blinking is worse at sometimes than at others. And he is also having a twitch in his neck for 2 months, and then a shrug of his shoulders for 3 months. The child also clears his throat repeatedly. Bolega. And nothing physically wrong. And the patient has a paternal history of obsessive compulsive disorder. बेटा ऐसा है तो बाप को obsession है. So the most likely diagnosis is Tourette's syndrome. Tourette's disorder is what you need to remember. And always the best first line treatment should be alpha adrenergic medication like clonidine, guanfacine, instead of atypical antipsychotics to treat the Tourette syndrome. So multiple motor, vocal tics, and at least 1 year onset is during 18 years of age, before 18 years of age. So these are all the important part of the criteria. The OCD, Tourette disorder, tics, they are common in children who have had which infection in the last 3 months. Which infection? A very important question. So there is an entity called PANDAS, Pediatric Autoimmune Neuropsychiatric Disorder, associated with streptococcal infection. PANDAS, you should not forget, is associated with streptococcal infection. Certain vocal and motor tics like barking, coprolalia, echolalia, they have to be differentiated from psychotic behavior that you see in schizophrenia. How do you differentiate? So basically, if you look at schizophrenia, patients have other findings which are congruent with psychosis, like hallucinations, delusions, but they won't be there They will not be there in the Tourette syndrome. That's how you differentiate. Before you start treatment for all these vocal tics, Tourette syndrome, what is that you should rule out? Streptococcal infection. Because pandas, just before we discussed that, pandas is a important diagnosis that you need to have in your mind. A patient brought child with Tourette disorder for treatment, they have a concern about tardive dyskinesia, and they want to give a drug which will be useful for Tourette, at the same time will not have tardive dyskinesia as a side effect. So what is that drug? It is clonidine. Clonidine is an alpha-2 agonist which does not cause tardive dyskinesia as a side effect, and it can very much be useful for vocal motor tics, is what you need to remember. So when you are examining a patient with a possible Tourette syndrome, you should inquire carefully about the family history. Which important family history you need to take into consideration while examining Tourette? Parental history of OCD should always be considered. It is more common in families of patients with Tourette syndrome than in general population. In fact, 50% of patients with Tourette syndrome will have obsessive compulsive symptoms, is what you need to remember. This is a very important question, doctor. Which is the only antipsychotic which has an anti-suicidal properties, which is used for patients with schizophrenia? Do anybody want to make a guess for this answer? Come on, punch your answers, doctor. Which is the drug that is the only antipsychotic that has anti-suicidal properties for use in schizophrenia? Anybody want to try and answer? Come on. Small challenge every day will make you stimulated to go back to the Incus app. Punch your answers, doctor. I'm waiting for your answers. Rishabh Shetty, Arun, Pusa, Arvind. Very good. Arun is guessing clozapine. Clozapine. Any other guesses? Come on, punch your answer, doctor. Question for sale. Come on, punch your answer, doctor. मैं आपके आंसर के लिए प्रतीक्षा कर रहा हूं. Which is the only antipsychotic? Sophia Panda is saying clozapine. Because that's the only drug that we know, right? Super. Clozapine is the only antipsychotic with anti-suicidal properties for the patients with schizophrenia. कल के NEET PG exam में ये question जरूर आएगा. Paper out. Be very sure. Now, doctor, certain definitions you should be very, very sure about. What is tangentiality in schizophrenia? The point that person want to tell in a conversation is never reached. Responses usually in the ballpark. What is loosening of association? No logical connection from one thought to the other. That's called loosening. Flight of ideas. Thoughts change abruptly from one idea to another with rapid speech, pressured speech. Neologisms means made up words. Hinglish is Hinglish. हम Hinglish में पढ़ाएंगे. Hindi plus English. Word salad. Incoherent collection of words. Clang association. Word connections due to phonetics rather than actual meaning. My car is red. I have been in the bed. It hurts my head. Or my car is red. I have been in the bed. It hurts my head. Red, bed, head. Only phonetics are connecting, no association. Thought blocking. Abrupt cessation of communication before the idea is finished. abrupt cessation of communication. I love you बोलना चाहते हैं मगर I love बोल के बंद कर देता, और गर्ल को कंफ्यूजन रहता, मुझे यू है या मेरा सहेली है, मेरा रूममेट है, मेरा बहन है, मेरा दीदी है, मालूम नहीं होता. सो आई लव तक आके बंद हो गया. थॉट ब्लॉकिंग. Now, one of the favorite questions of the examiner, doctor, in the tomorrow's NEET PG exam, alcoholic hallucinosis versus delirium tremens. Bhaiya, alcoholic hallucinations are those hallucinations usually auditory, although visual, tactile, anything can occur. In contrast to delirium tremens, see, alcoholic hallucinosis versus delirium tremens, you should differentiate. Delirium tremens में होता है clouding of sensorium. So there is no clouding of sensorium in alcoholic hallucinosis. And the vital signs are normal. That's what you need to remember. Now, this is one of the favorite questions of the examiner, doctor. What are the symptoms? Good prognosis, bad prognosis, schizophrenia. This is a short NEET PG MCQ, doctor. लिख लो, याद रख लो, जरूर आएगा कल के एग्जाम में. So late onset, better prognosis. Good social support, better prognosis. Positive symptoms. Mood symptoms, acute onset, female gender, few relapses, and a good pre-morbid functioning. Better prognosis. Early onset. One of the varieties called hebephrenic schizophrenia. Poor prognosis. Hebephrenic schizophrenia, poor prognosis. Why do you call hebephrenic schizophrenia poor prognosis? Because teenage में शुरू होता है ये schizophrenia, इसलिए. So always early the onset versus the prognosis. Negative symptoms, gradual onset, male हो के पागल हो गया तो dangerous है. Many relapses, poor pre-morbid functioning, like socially that person is isolated. Then worse prognosis. Schizophrenic patients who are treated with second generation antipsychotic, what you need to be careful. You always should evaluate second generation wala. You have to evaluate metabolic syndrome because you need to check for weight, body mass index, fasting blood glucose, lipid assessment, BP. For a first generation, haloperidol and all those drugs. Extrapyramidal side effects को देख लेना, like acute dystonia and tardive dyskinesia. Schizophrenia versus delusional disorder. ये भी very, very important NEET PG MCQ. You have to be very sure. Schizophrenia में होता है bizarre, non-bizarre delusions. Whereas delusional disorder में होता है usually non-bizarre. Daily functioning is significantly affected in schizophrenia. Whereas delusional disorder, daily functioning is not affected. Then schizophrenia में delusions के साथ ही साथ delusions होगा, hallucinations होगा, disorganized speech, disorganized behavior, negative symptoms, they're all accompanying things in schizophrenia, which are not seen in the case of the delusional disorders, is what you should remember. Then another very important definition में गड़बड़ नहीं होना NEET PG में. भैया schizophrenia में होता, schizophrenia क्या होता है? लाइफ लॉन्ग. पागल एक बार है तो जिंदगी तमाम पागल. Schizophreniform, that is schizophrenia more than one but less than 6 months, then you call schizophreniform disorder. Schizoaffective schizophrenia पहले से साइकोटिक है. एक दिन डिप्रेशन में रहता है, एक दिन वो हैप्पी रहता है, एक दिन हंसेगा, एक दिन रोएगा. सो जब पागलपन के साथ शिजोफ्रेनिया के साथ मूड डिसऑर्डर भी है तो शाइजो अफेक्टिव, अफेक्ट बोले तो मूड। शिजोटिपल होता है पर्सनैलिटी डिसऑर्डर, शिजोटिपल होता है पर्सनैलिटी डिसऑर्डर। पैरानॉइड, दे आर वेरी सस्पिशियस। भाई 999 रुपीज में 3 साल का एक्टिवेशन, इतना कंटेंट क्यों दे रहे? ये सच है या झूठ है? सच है या झूठ है? क्यों 999 में दे रहा है? ओनली 999 रुपीज में 3 साल का 1000 डेज का दे रहे, क्यों दे रहा है? Always suspicious, that is paranoid. और they have magical belief, भाई मैं कोविड पेशेंट को ऐसा करे तो उनका पूरा लंग में रेडिकुलर नोडुलर ओबेसिटी चले जाएगा, मैजिकल बिलीफ। Similarly, eccentric nature, lack of friends, social anxiety. So that is a personality, उनके पर्सनैलिटी ऐसा है। शिजोइड पर्सनैलिटी डिसऑर्डर क्या होता है? शिजोटिपल अलग है, शिजोइड, शिजोइड मीन्स शर्मीली शर्मीली जिंदगी मेरा, I don't want to talk, I don't want to knock, I don't want to be friend, I don't want to come. So do not disturb, D&D batch होता है ये लोग, schizoid personality, solitary activities, lack of enjoyment from social interaction, no psychosis, but that is important. That's the reason it is personality disorder. So that is all the story, doctor. आज के चाय पे चर्चा विद डॉक्टर मुरली भारद्वाज समाप्त होता है। दर्शकों, आप सब रोज पढ़ना है, एवरी डे वी शुड स्टडी एटलीस्ट 1 to 2 hours, 3 to 4 फ्रेंड्स रहना है। और Incus ऐप में ये सारे वीडियोस आर अवेलेबल, पावर पॉइंट्स आर अवेलेबल, frequently asked questions, question bank, everything available. So please tell all your friends to subscribe to Incus app and enjoy a wonderful preparation and become topper, and send me a laddu in WhatsApp about the good news. Good night.